Hey everyone, welcome back to another episode of the Outcomes Rocket. So glad you tuned in to this founder's story. Today I have the privilege of having two outstanding guests. First, I want to introduce Justin Lam. He's the co-founder and CEO of Cool Blue VA. And I also want to welcome Dr. Carrie Lam, who is a board-certified family medicine and anti-aging and regenerative medicine physician focused on functional medicine at her practice, Lam Clinic. Welcome to the podcast, guys.
Good to be here.
Thanks so much for having us, Saul. Happy to be here.
It's such a pleasure. And I'm so excited to cover a lot of things that I think matter to our listeners, being healthier, not being burned out. And so you guys are doing both of those things. To kick things off, tell us a little bit about yourselves. What inspired your work in healthcare?
Yeah. So I'm the sister of Justin Lam. There's actually 4 of us siblings, and we actually all work together. So it's pretty amazing. I'm very blessed in that way. But I would say it probably stems from my dad, as he was the one who actually first got into integrative medicine and instilled that into us. So that's why I came out, wanted to be a doctor to be able to do integrative medicine. But as you can imagine, going through med school, going through residency, you get zero education on any business, any administration, any HR management, none of that. So me coming out of medical school and residency, and I really wanted to help people get to the root cause. That's what functional medicine is. And integrative medicine is like not only pushing pills. I wanted to do supplements. I wanted to do nutrition, lifestyle, IVs. Like I wanted to have my own clinic because that's not like in our regular normal system. But coming out and learning everything, not only the medicine side of things, but also all that administration side of things, I was just like overwhelmed. And it was just so much. I couldn't do it. And when I came out, I was also thinking like, hey, I have to think I want to start a family. Like I was ready to try having a kid, but with all that stress and loading up on me, I just wasn't able to. Okay, so I came out, I opened Lam Clinic, and we started out with tele because this is like right when the pandemic started, and then we opened up. But then you can imagine just me, one person as a doctor coming out and doing everything. I was like burned out basically very easily, and so I found that virtual assistants were my first into helping lighten my load. And so, yes, we got my first virtual assistant. And then after the first one, I started getting 2 and 3 and 4. It's kind of like an infection, you'll say. Those because they're so good. You just want to keep getting it. And they're so beneficial because I think we all know we all have staff infections, you can say. It's like so hard to keep staff. There's such high turnover, and you spend such a long time training. It really just like it's a hard on every person. I'm sure like everyone understands that pain. And so, but and the same with VAs. There is turnaround, and that's probably something we'll talk about later. One of the pain points that I had to go through. But with our VAs now, I know I've had my VA for the past the oldest one for the past 4 or 5 years, and she's been with me for this whole time, grown with me, and has really helped me in my practice. Literally anything I need her to do, she'll do. Right, like that in a nutshell has also helped me in that now I am a mother of 2. I'm able to do my practice. And to be able to also help other doctors to be able to find, hey, like it's not all on you. Like my goal is to be able to have integrative medicine be available for all, but I also want doctors to be able to, and health systems, not practice integrative medicine. But how do you get there sometimes if you don't have that knowledge about business or HR or administration or like staffing issues? Like this is one piece of the puzzle to be able to lighten your load, that staffing problem that you might be having, So I think it's changed my life, and I definitely want to share that with other people.
That's awesome, Dr. Lam. Really appreciate you sharing that, and congrats on your practice, your VAs, your babies. Things are going well over there.
It is. It's super busy, but I am able to like pass it along and not just all on me. Mhm.
That's awesome. And Justin, talk to us about you.
Yeah, so same kind of the same with Dr. Carrie here. I mean, our dad is a doctor, so we kind of grew up in the medical field. I had been practicing in the health industry for about 5 to 6 years, not practicing medicine, but just involved in the healthcare industry for about 5 to 6 years before Dr. Carrie graduated and decided to open up her clinic. Since I was in industry already, I opened up the clinic with her. I was basically running the operations, managing the clinic. And yeah, we opened up basically at the start of the pandemic. So we were having a tough time staffing people.
Sure.
The government was paying people to stay at home and collect paychecks, right? So we had to find a solution. So luckily, we were able to get these virtual assistants. That has really helped Dr. Carrie's practice grow and balloon. So she's working with 5 other providers now, full-time providers, and that business has really grown up. Right. So we decided to open up another business, Cool Blue VA, to really help other providers, other healthcare industries really get that, experience, get that help that they need so that they can really grow and explode on their business as well.
That's great. And Justin, you also went to med school, right?
I did go to med school. I had an Asian dad who wanted me to go to med school. So I obliged. My heart was never really into it. I liked doing business more. So I got the degree, but I never practiced. I just dived into still involved in the healthcare industry, but just doing more business, marketing, and operations.
That's cool. Well, it's great to have that experience and that background. The understanding brings empathy in a big way. So I think that's cool that you did that. All right. Well, let's dig in, right? A lot of the things that you're hearing in the industry are burnout, so many providers leaving, there's not enough providers to patients. Talk to us about what Cool Blue VA does to add value to the ecosystem that's in major pain right now.
Yeah, absolutely. Doctors just need help, and it's tough to find good help nowadays, right? And so that's where Kubu VA steps in. We basically will find you medical professionals that are based in the Philippines, and they work remotely during your office hours to help you out with anything that you need. So we'll find nurses, you can find pharmacists, physical therapists, insurance agents, customer service agents, anything that's a pain point for you that you need help with, that you're struggling with in your practice. We find those staff for you, and you're not going to have to pay an arm and a leg to get that help. It's basically going to be $9.95 an hour. So it's super affordable, and you can offload all that stuff so you can spend your time seeing more patients, thinking more high level, running the business more effectively, and not just get bogged down and burnt out, right?
I love that.
I can add to that. Just personally, in my clinic, so I said we started with 1, and I can say we have now over 40 VAs in my clinic. So we have like 6 for customer service, right? Like meaning they answer all the phone calls that come in, even the texts that come in, they're able to answer and screen through. Like our answer rate at our clinic is 95%, meaning all the calls that come in, they're going to get answered, right? And everyone knows that feeling of, hey, you're trying to call your doctor and no one is answering. So that's like number one thing that like great, like patients love it. And then just personally for me, like I have 2 scribes basically per person so that I can see more patients, per provider. I mean, so my scribe is with me and they're just like any medical assistant. They're just virtual. So they're on with me during my call. They listen to my whole appointment so that even before, let's say it's a virtual call, they're able to charge, they're able to look up their insurance eligibility, and then they're able to do the medication reconciliation. And then during the visit, they do the note with me. And then after the visit, they send the labs with my approval. They prep the prescriptions and the supplements, and then they can counsel on the patient even after the visit. So literally because they are trained medical registered nurses in the Philippines, they have already baseline knowledge of all the things that you're talking about. And so it's much easier for them to assimilate to become a scribe here in America, right? Because they already know how to spell all these medications, let's say, and this stuff like that. And then I have like an insurance practice, or I have like another 6 VAs just like running insurance eligibility, doing the billing and things like that. And then I have back office uploading, answering to like jelly beans, like, the portal messages, and doing referrals. So that all gets farmed out. So really all I have to do is, okay, I go see in my patient, and then let's say at 5 o'clock, I'm like, okay, clock out, I'm done. Like notes are done because my scribes have worked on all of them. I still, yes, go through them, but it's much quicker process. And then I have nothing to worry about. Just
That's
kidding.
awesome.
Obviously, I have so much other things.
No PJ time though, right? No PJ time.
But like that's the medical side. Then hey, if you need like content creation, I have another team that just does social media and comments and on content creation, writing, or so it's like literally anything, to like ordering my lunch and scheduling for me. So they can be a part of your whole life. It doesn't matter what you need. They're like a personal assistant, but they also help you with any task that you need in your everyday life.
That's great. So some great applications, and there's so many things that go into managing a practice. The insurance. Let's not even start there, right? Prior authorization and just everything, from the medications to the procedures. It's so great to hear that, and then even the marketing, helping you get more patients in the door. Like all these things keep clinicians up at night, and you guys are saying you have teams of VAs that know the medical side of all of these things.
Mm-hmm. Mm-hmm. And if they don't, they're easily trainable. You have your own standard procedures. They still need to get trained, right, based on what you do, but they have some kind of baseline medical knowledge. Mm-hmm.
Love that. Well, question here then. It's like, what, there's VAs out there. How would you say what you do is different or better than what's already out there?
Yeah, that's a great question. So, we're physician owned, so we really take pride in that, so we know what the pains are really to help, to running a practice, to making it successful. And so that's what we really strive to help other doctors with, so they get the virtual assistant, but they also get us and they get our expertise as well. So if they're having any problems, I'm always happy to jump on a call with somebody and say, hey, let's figure this out. Let's see how we can utilize a VA to make this work for you guys. Or if they have any idea, it's hey, I'm trying to think of how to do this. I'm always happy to explore options with you guys to make sure that you're getting the best value out of your virtual assistants, and that you're helping your practice grow as efficiently as possible.
That's great. And there's a lot of things that could get you sidetracked. And especially as business owners, Justin, you're on the VA side of things. Dr. Carrie, you're running your practice. We learn more from setbacks than successes. So I'd love to hear from both of you, biggest setback and the biggest key learning that came out of that.
So I mean, for me, we learned from hiring the VAs, I guess, in the beginning, right? we didn't have Google VA 4 years ago. So then we were actually hiring VAs and seeing, who are good quality candidates, who are not, like dealing with all the things you deal with any staff. But obviously there are like layers to things like earthquakes or typhoons or acting, it's COVID. Everyone gets COVID. Like what are the ways to actually like maneuver that? So it just like finding any good staff. It is so hard. And so that's what's nice about Google VA, because they literally, they vet every person. They make everybody go through a training session, and then they test them at the end of the training session. If they don't pass, they're not going to be a good candidate. And so they go through this first layer that you don't have to go through when you're looking for a virtual assistant, right? So I personally know we've gone through so many virtual assistants, especially in the beginning, but ever since we started this like vetting process, it's just so much easier. People actually stay longer. They're more motivated, and they don't have as many issues as we did previously.
That's great. Yeah, some great learnings.
Yeah, absolutely. Sourcing the right virtual assistants was real tough in the beginning, but that's why we instituted like an amazing 3-step interview process now to make sure that they're good candidates. And we also have a training program that they have to go through as well to make sure that they're really qualified before we even assign them out to you guys. So from start to finish, really only about like 10% of our candidates actually qualify and graduate. It's a very low number there. And we took a lot of pains. I've interviewed thousands and tens of thousands of people, to fine tune that process here. But even then, still, there are limitations when we're first starting out. You always have to set expectations, right? Because these virtual assistants, they're so eager to please.
Mm-hmm.
Because they're so happy to be working with these doctors and with these practices that, sometimes they're going to try and take on more than they can chew and more than they can actually do and perform. And so early on, we found that, we had to set expectations, and what we found is better to specialize these virtual assistants instead of having to try and have one person do social media, do insurance, do scribing, and do admin and billing, and then they're just not able to do anything really efficiently or all that well. So, now we have more specialized virtual assistants who can really be at the top of their game in whatever you need to do in that specific tasks. And once you get efficient in that task, then you can always train them and add on more, and then they can learn more with you. Because the beauty of it is that you get the same virtual assistant working for you every day, day in and day out, in your practice, in your office, in your business. So they get to know you, they get to know your staff, they get to know your patients, and over time they can just learn more, they can take on more responsibility, and they can do more. But we have to set expectations the front that, you got to take it step by step first, right? Don't just load them up and then the virtual assistants could get burnt out, right?
Yeah.
Yeah.
No, I think that's great. Yeah, you don't want to shift your burnout to the VA, right?
Yeah, exactly. Right. Because these virtual assistants, they're so eager to work. They don't want to work 40 hours. They want to work 50 hours. They want to work 60 hours, because they get paid well. Right. So they're going to try and work as much as possible, sometimes to the detriment of themselves, So what we have to kind of hold them back to is like, no, you got to take the weekends to rest sometimes. Yeah.
Yeah. That makes sense, man. Yeah. I love that. Great learnings there. And it sounds like tens of thousands of interviews. You guys have distilled the process. And I also like the specialization. So, if you guys are running a practice and you've thought to yourself, I cannot keep up, like, Whole Foods is paying people $20 an hour. This is what people expect right now. There's a better way. There's a better way, and you could get super talented, highly qualified people. It is a global environment, and now's the time. And so I love the success stories you guys have shared, but also the challenges, right? Because they're very real with what we're all faced with. What closing thought would you leave leaders listening to this today? And where can they find you guys if they want to learn more?
Yeah, absolutely. My one thing to take away from this is if you're just starting out as a doctor, you have to get your phones answered. There's no choice in that matter, because that's going to be the lifeline of your clinic, of your business, of any business really. Right. And so we actually had a doctor. They're actually really successful. They had 8 providers with them, but more than half of their calls were going unanswered. And the patient was waiting like 7 minutes just to talk to somebody on the phone. And they just got 2 VAs, and within 2 months, their answer rate was down to, they were only getting like 5% missed calls.
That's awesome.
And the average wait time was under like 50 seconds, so it's a very simple thing to do and very easy to implement, but your patients are going to love it. You're going to love it. It's just going to be super easy for you. And what we have really to help people out, is that we're going to be offering all our Outcomes Rocket listeners a 2-week free trial, So
Oh,
you
that's
can
awesome.
work with a virtual assistant for 2 weeks, absolutely free, 40 hours a week. That's a total of like $800 in value, to make sure that you guys are happy with your virtual assistant and it's going to be a good fit for your business and for your office here. And you just have to go to coolblueva.com/outcomes rocket. And that's outcomes rocket in just one word. Yeah.
I love it. Well, thanks so much for that, Justin. Folks, we got to take advantage of that. Doesn't hurt to try, and it's probably hurting you not to try. So definitely take advantage of that. Thank you for that, Justin. Dr. Carrie, any closing thoughts from your side?
Yeah, the nice thing about Kubu VA is that you won't have to feel alone in a lot of the things that you do. I think these medical virtual assistants, a lot of times what I've seen is that also maybe providers or maybe institutions, they don't know how to implement the usage of virtual assistants. Maybe now in the pandemic, after the pandemic, we're able to work remote a little more, but still it is a different breed. But what's special about Kubu VA is that, like you said, we're physician owned. We take pride in really helping doctors and offices and managers to figure out how to really utilize their medical virtual assistants in the best way. We're not just like, okay, here's the VA, here, go and figure out how to use it. Like we're able to implement and work and consult and make sure that you're happy with your VA and the VA is happy with you and it's a good fit. So they are also, we treat them like family at our clinic. They're, like I said, they've been with us for a long time. So we want good staff that stays with you and that you can also keep for a long time. So quality is what I would say for Kubu VA. And yeah, take advantage of the free 2 weeks and you'll be hooked from 1 to 40.
Yeah. The virtual assistants in Lam Clinic have been around longer and the physical staff. Clinic, actually. Yeah. It's pretty wild. Yeah.
That's wild. Well, there you have it, everyone. Make sure you check out the show notes. If you're driving, hit pause, pull over, coolblueva.com/outcomes rocket. That's where you're going to find the offer. And just, think about this. Now's the time to take your practice to the next level with a VA, a medical VA, and get your phone answer rate as high as Dr. Carrie. And I mean, how about marketing? I mean, you had me at marketing, that in itself would be huge. So now's the time. Thank you all for tuning in. And Justin, Dr. Carrie, thank you both for being with us. This was a lot of fun.
Thank you very much. Have a good day.